Getting ready for your wedding. These are some of the most common concerns that I treat with patients before their big day, and this is the schedule that I like to follow. For most people, it's a good idea to start planning ahead of their wedding, like a year before ideally. One of the most common concerns is acne or breakouts. We usually like to do a series of laser treatments for that, and it kind of depends on what your main issue is. If your main issue is oiliness, we'll use a smooth beam laser. If your main concern is red lesions, then we'll use a V-beam laser for that. Clogging of the pores, we tend to use more of a resurfacing laser. All of these require multiple treatments, so about 3 or 4, about a month apart. You really want to start that at least 5 or 6 months before your wedding. Acne, unfortunately, in some people will lead to acne scarring and uneven texture. And for that, we usually use a combination of resurfacing lasers, radiofrequency microneedling. Sometimes we'll use fillers for that, TCA, subcision. Usually these require also multiple treatments, about 3 to 6, depending on which modality we do and how severe it is. It takes about 3 to 6 months to see the results of that. So you want to start that at least a year before. Next is uneven skin tone or pigmentation. For that, resurfacing lasers work the best. You can get good improvement with each one. It depends a little bit how intense the laser is. If you do something gentle like clear and brilliant, you're going to need to do a few of those, but you have minimal downtime with that. If you are going to step it up and do a Fraxel laser, you'll have more downtime, like 5 days of redness, but you get a much better result with that. Another issue for people is redness and broken capillaries, and for that we do a V-beam laser. It's a vascular laser that shrinks the blood vessels. We usually do about 3 or 4 treatments, about a month apart. You have to start that a little bit earlier, so about 3 or 4 months before. Another issue is volume loss, especially if people have lost a lot of weight, but also people who genetically maybe have a recessed chin, or they have flat cheeks, or they have a lot of hollowing under their eyes. For those people, it's really a good idea to do some filler. Filler lasts about 1 to 2 years. It takes about 2 to 4 weeks to settle, so I would not do it right before your wedding. I would do it maybe at least 6 months beforehand, because it'll still be in effect by the time your wedding is there, and you can kind of get used to it, because it can change the shape of your face. You want to restore volume, or in some cases even augment volume, like for the chin or the cheeks or the lips. Next is fine lines and wrinkles. Botox works really well for that. It works mainly for dynamic lines, meaning lines that you see with movement, that eventually will create static lines too. So if you do it on a regular basis, you can even improve static lines, but that takes a long time. If you just want to do a little bit of Botox before your wedding, I would do at least one dry run about 3 months beforehand, and then the actual Botox for your wedding should be about 3 to 4 weeks before the wedding. And then finally, if you kind of feel like your skin looks dull or it's not glowy, Clear and Brilliant is a great way to spruce up the skin, not a lot of downtime. So if you don't have a lot of issue, but you just want your skin to look glowy and your makeup to go on really nice, Clear and Brilliant would be great, and you can do that a week before the wedding. If there's anything in this list that I didn't mention, please feel free to come in and we can discuss your concern and come up with a plan.